Want to live longer and better? I'm Dr. Jess. I'm a physical therapist, and in this podcast, I bring you real, science-backed strategies from physical health providers, mental health providers, and nutrient experts, so you can build strength, protect your mind, and fuel your body for decades to come. Longevity starts here. Welcome back to our month of talking about movement and how important that can be for just us living that longer, healthier life, and talking about all the barriers to why do we get movement into our day versus not getting movement into our day. And so with us today, we've got a special guest, Dorie Hanson, and we're going to talk a little bit from the mental health perspective of how movement is good, different reasons why it helps us, more than just the benefits that I covered last week. So I've got an episode that was released last week that has more of the physiologic benefits. We're going to talk about from the mental health side and what those benefits are. So Dorie, first, tell us a little bit about you.
Hello, I'm Dorie Hanson. I'm a licensed mental health counselor in Florida. I am currently operating under Quiet Tides Therapy myself, so I'm in private practice. I've worked in mental health since 2015-ish, full-time, and have worked in all different settings. I've worked in healthcare. I've worked in criminal justice. I've worked with grief. I've worked with trauma. Those are my 2 certifications currently within grief and trauma. So I have a lot of experience and a lot of just different, working with different populations.
Yeah. And so when we talk about movement, and again, like we can call it movement, we can call it exercise, we can call it whatever you want to name it. From the mental health perspective, what are ways where you feel like you see people really benefit from movement?
So movement can impact mental health. I mean, obviously, in any doctor's appointment you go to, what do they say? Like, eat right and move, right? That really applies to mental health in a lot of ways. And so when you think of depression, for example, when we get into a depressive episode, our tendency is to isolate. We want to isolate and sit still and not talk to anyone, not move, not do anything. And that's actually feeding the depression, right? That really feeds that depressive cycle. So movement, for example, with depression, being able to get out and walk around the block, right? Being able to get up and go to the store and come back. That in itself is challenging some of those depressive symptoms that are trying to just exacerbate over time. When we think about anxiety, another, of course, just really common symptom and diagnosis that we see everywhere. With anxiety, I really like to think of anxiety forms as energy in our body. And so if you think of like, I'm feeling really anxious, think about like all that energy that's building up. And so movement is a great, great, great way that we can, I tell people, go walk around the block, go run around the block, come back and assess. Okay, do I feel like my energy is kind of like I'm releasing a little bit? Or like I'm not so pent up, I'm not so anxious. If that's the case, great, right? Like you might be done for the night. You say, I'm still feeling anxious. I still feel like I have just a lot of energy. Go around the block again. And then we can notice like the more that you really are in tune with yourself and you watch that go down, that's going to help manage your anxiety as well. So those are just 2 examples using just common diagnoses that we see within mental health.
I can tell you like from personal experience, like especially when I was in that like bigger stress state. So let's say in undergrad, when you had like, you've got papers, you've got presentations, everything's like building up with like all of the things that you have on your plate. When you don't take the time to exercise, it's like even your efficiency is less because you get stuck in this like perseverating thoughts of like, oh, I've got to do this and I've got to do this. And you're pushed in so many different directions that like you're not getting anything really done well. And just pausing, going for a 30-minute run, for me, would make all the difference. I would calm down, I'd sit down, and boom, I would just like finish a paper in like no time. Or like, just any period of time where it's like, I've been like, I'm just not myself. I'm not doing my normal efficiency with whatever. That's when for me, I noticed that it's like, okay, like I need to move. And for me, it's like magic. I'm like, how did that work so well? And I didn't realize in undergrad what I was doing. I just knew that if I did this, I felt better, but I didn't have as much intention behind it. And then the more you understand, then you're like, oh, that makes a lot more sense, which then for me at least, because I can understand it, now I consider it to be valid. And this is useful and valid because I understand it. Instead of just like anecdotally it working.
Yeah, absolutely. And when you also think, I mean, kind of bringing the physical therapy and the physical aspect too, when you're working from home, so we see this in mental health a lot right now. Working from home has so many benefits, right? Like you have a better work life balance oftentimes. You can do more. You can start the laundry in the middle of a meeting, and right there's a lot of benefits. But there's also a lot of pressure we've noticed from working from home that like, I need to be connected to my computer. And I need people to know that I'm on. And that leads to kind of the stiffness. So stiffness and staring at the screen for 8, 9, 10 hours a day. And what a lot of people don't think about is the impact of physical health, physical pain, and mental health. So I see a lot of people with just chronic pain, which of course I'm sure you do as well. That's your job.
Yeah.
But that chronic pain then impacts our mental health. And that chronic pain can come sometimes from, or just that new onset of pain from just sitting, right? Sitting and typing and staring. When we're not allowing ourselves to have that movement, that exercise during the day, as small as that may be, then that's going to exacerbate that shoulder pain I already have, right? When that pain starts, then my mental health kicks in of, oh my gosh, I can't believe this is still bothering me. What am I going to do? Like, am I going to need surgery? Am I going to, now I can't go work out because this is hurting. And so then it just kind of feeds us, it's very cyclical. And the way then we don't move, then we have more pain, then our mental health suffers. So there's a strong connection there. Just when we're thinking about work, whether you're in office or at home, of course, but primarily I'm seeing this a lot with people working from home nowadays.
Yeah. And one of the things that I've been kind of pumped to see like enter the marketplace is those treadmill things that are right there at your desk, like the walking pads. It's like so cool. So for me, I'm biomechanical. So I'm always thinking like, what kind of stress are we putting on our joints and our ligaments and our tendons and our muscles that are leading to why we have especially chronic pain, which is just pain that's persisted for multiple months. So when you're standing, your hip is in a neutral position. When you're sitting, your hip is in a 90-degree bend. And so that completely changes the stress that we're putting on our spine. When we walk, our hip is actually going into extension. So, and we're getting gentle rotation to the spine when we walk. So it doesn't matter how fast you're walking when you're on those walking pads at your desk. The point is that your hip is going through range of motion, your spine is doing gentle rotation, and so it's so helpful for your body physically. And now that you're getting that movement and you're getting a little bit of that increased heart rate, it's like everything starts calming down. So like to be able to like take a call on a walking pad where you're not out of breath. I've had so many people like, no, like I can't I can't use those and work. I'm like, okay, don't think of this as a treadmill at the gym. This is different. This is a walking pad at a desk. So think a slow pace where you can hold a conversation. Nobody's going to hear that you're like out of breath. And it's like, oh, just that fast? Yes, this isn't a workout treadmill. I mean, you can walk quickly on it, but like if you need to type or you know, use a mouse to put something in, like you shouldn't be walking so fast that you can't, control it. But I've had this make really, really big impacts on my patients. And the day goes by so much faster. The pain level is way less than when we sit all day. And again, with chronic pain, the minute that it starts getting worse and worse and worse, and you feel like, oh no, now I'm going to be stuck. And later I'm not going to be able to do what I want to do. And all of those perseverating thoughts that start happening, it's like, are you going to be motivated to go to the gym at the end of the day if you've been in pain all day at work? No way. Like, I wouldn't be motivated to go to the gym if like my back was hurting from sitting all day. Like, I can go fly a kite. Like, I'm going to go home and lay in bed, put a heating pad on. But what did that do? That cycle of stillness during the day to go home and be still, it just, again, it kept you in that vicious cycle.
And I like to think about, I'll bring this to what I think can be very relatable for a lot of people. Those walking pads and like the movement kind of throughout the day as well, but walking pads specifically. So think of when you're on a meeting, and we've probably all had those coworkers in the past that just They either are the ones that it's 7:59 and they ask that last question, right? That's going to like push the meeting over, or maybe for whatever reason they trigger us, they frustrate us in some sort of way. So when we think about that, like in our mental health, we get hyper focused. So if we are just sitting still, we're stagnant. All I'm doing is focusing on this person, on my frustration. I'm allowing myself to get more anxious. I'm allowing myself to get more frustrated, more irritable. That's feeding just kind of a negative cycle, a thought process that can happen. When we incorporate walking, or even like we talk about like fidget spinners and stuff, but specifically here, walking, that is now taking my brain from, I cannot just hyper focus on this one thing, on this one frustration, this one annoyance. Now it's forcing me to like, for one, once again, decrease that energy. So once I get irritable and anxious, my energy starts like going up. I start building up. So it's already helping me to kind of get to a baseline of emotional regulation. So we get back to our baseline. Then I'm not going to be so hyper focused on every irritable thought that I'm having, or frustrated thought that I'm having towards that person, towards work, towards whoever at that time, because that walking is distracting my brain. It's kind of bringing it to a different area. So I'm not having to just like hyper focus on this one area.
I get that 100%. Like I do the same thing where I'll hyper focus on something, and I try and catch myself as best I can. Like, why am I so irritated right now? Trying to find some solution to redirect that energy. But like, I think also one of the things I wanted to ask you, just because of your experience, is when we move and we are getting that chemical release, those hormones that are released, how does that kind of affect us as well?
Mm-hmm. I mean, dopamine is huge, right? Like
So good.
a dopamine, it's so
It's just,
good.
I love me some dopamine.
We want that dopamine hit, right? And that's when we're not moving, we don't get that release, right? And we really need that dopamine release, that dopamine hit to fuel our day, to make the next thing doable. Whether that next thing is something as small as like I need to go change the laundry, right? Depending on the day, our small tasks are big wins, and like really being able to reframe in that way. And so that release, right? So if I can go and I one person I work with, and he just did 10 push-ups on his knees, right? In between really frustrating meetings, really like difficult meetings. That is then a dopamine release. So then it allows him for the next day, right? The next day that they can, or the next task, the next meeting, the next thing that needs to be done, right? It feels more manageable.
I like that. I like the 10 push-ups because you can pretty much do that anywhere. You could do it against a desk. You could do it against a wall, like anywhere. So that's awesome. That's an easy to implement one. And the other thing I really love figuring out, because I always work with people on trying to like get movement and exercise to be part of a lifestyle change. So, because in the clinic, I'm prescribing exercise based on like, specific things that are imbalanced or whatever that might be. And and typically people are like, they get it because it's like, oh, I feel better when I do this. And trying to get that leap into like, because it is a leap. It's not a trickle, it's not a walk, it is a leap to get that into a lifestyle change. And so one of the things I really try and focus on is that dopamine release that we get when we even have small victories that we celebrate. And so I think that's like one of the things from a mental health perspective that we don't always truly appreciate, or what are all of the different ways we can get dopamine to release? Because it's not just going for a walk, right? So like, Dorie, what are just other simple strategies so that we can kind of keep that movement and that progression going forward, so we don't like hit a bump, get frustrated, and then go, I guess I'm not good enough, or this isn't for me, or whatever it might be.
We really have to lean into, for one, acceptance. So acceptance is a huge technique, and kind of really like we'll just call it a technique, but that I use in my therapy session. And that acceptance is setting attainable goals and accepting that that's where I am today. So my attainable goal might be walking around the block. And that's attainable to me personally. right? And then accepting, we call it radical acceptance. It's a DBT technique. I'm just going to radically accept that like I was or was not able to do it that day, right? And so it's decreasing that pressure that we put on ourselves. So setting a plan for it. So trying to really work on like what feels attainable, what doesn't feel like something I'm going to make excuses for to not do. What is attainable in my life and in my day? And then accepting when we're there that like I can do this today or I cannot. Right. And what that's doing is allowing people to really be in control of their own lives because it's easy, just like you're saying, it's really easy for someone else to say, hey, if you go walk a mile a day, like you're going to feel better and all your problems are going to be solved. That's easy for someone else to say. That's going to be really hard for me to implement.
Right.
Really hard. That's just might not be attainable for me. So set attainable kind of goals and expectations, and then move into that acceptance about where you are that day. Because I might be able to walk around the block one day, but then the next day, my baby woke me up at 2, 4, and 5, and I'm not going to do it. I'm just not going to do it. And I'm accepting that that's where I am in that day. It doesn't lead to us trying to make excuses, right? Like to say, okay, therefore I'm not going to do it the next few days. It's now let me get right back to the attainable goal I set and try again tomorrow. So really just being nice to yourself and just giving yourself a little bit more grace. Because especially with exercise and movement, the message that's sent out is you need to go hard, you need to go extreme, you need to be these like elite athletes if you want any change to happen. And that's just not realistic or fair for a lot of people.
For the vast majority of people,
Yeah.
I mean, it's really not. Even like some of the stuff that like, I'll post like things about like, here's some running tips or, things like that. And all the people like just try and shred me in the comments of like, you're not going to beat our race with that kind of, mindset. I'm like, a mindset of meeting yourself where you are. I never said this was going to help you PR a race, right? Like, interesting. Like it doesn't have to be that you're winning everything, right? Like, what if you're doing something just because it's helpful or good for you and you're not the fastest? What about that? But what if you're doing it in a sustainable way, in a safe way? It's just a concept that like we're working on and getting that message out there.
Yeah.
But it is like, I mean, people get very heated about like you either go big or go home or like I was even on a run, like it was middle of summer and my running partner, it was like it was hot. It was a hot day and my running partner was just like on the struggle bus and I was like, hey, we're fine. We're going to slow down. We're just going to run a little slower than normal. We'll take breaks when we need to. We're going to find sprinklers to dunk our heads in. Like we're not out here to impress anybody, right? And then there was this like group of young guys that were standing there, were just coming in from finishing a run. And this one guy like yells over to us, "You're not going to win a race with that pace." And I was just like, hey bud, it's about the journey. But it was like the last thing my running partner needed to hear that day, And I was just like, wow, man, like that was interesting that you felt the need to say that. But yo, we're not trying to compete with you. You have your win. Feel good. Like walk around with your shirt off and think people care. I don't. Right? No, like most people don't. So it's just interesting. So, and it's something I'm trying to work on with myself, right? It's like when I run, if I'm not running at the right pace, am I good enough? Right? Am I doing enough? Am I training enough? And eventually you end up learning, I'm out here. I'm out here. I'm doing my thing. I'm not the fastest person out here. Even if I'm the slowest person, I'm out here. Like, I literally don't care if everybody else passes me when I'm out on the run. I'm like enjoying it's beautiful. I'm outside. It's a Saturday morning. Like, go ahead. Like, I hope that makes you feel good. Like it's okay to just like be aware of where you are. It's hot. It's this, it's that. You didn't sleep well. Who knows? And hey, I'm doing it.
Yeah.
That took me a long time to learn that.
Yeah.
That was a hard lesson to get to that acceptance.
It is. It is. And then finding tasks that are for you. It's like yours is running.
I love it.
if you catch me running, like something is wrong. Like something is seriously wrong. So like not okay for me, right? But I will go to the gym and I will ride my bike and I will go on walks. Yard work is a great one for a lot of people who find like walking like difficult for whatever reason. Maybe they don't live in an area that they necessarily feel comfortable walking long distances, and there's so many different factors. So gardening, right? The gardening, the squats up and down that you have to do. The other day, I didn't want to go to the gym, so I mowed the lawn, and I had to stop 3 different times to get my lawn done. But I felt for me, I love that feeling of being in the sun, being hot, being sweaty. Like even if that's just for me sitting outside, like I feel like I've done something with it. So
Absolutely.
mowing the lawn for me was that something that's it's helping me in a few different ways. It's a task that I know needs to get done. It's also giving me exercise. It's for me, it's very like gratifying, right? Just that instant gratification of like, it's done. You see the progress. So that was really mental health wise, that was impacting me a lot and like in a few different ways, right? In really helpful ways with that movement, with that decreased energy, with I'm a big to-do lister. So checking off something on a to-do list, I mean, talk about like a dopamine release. Like for me, that's like huge. So everyone just has to find their own thing, right? Like whatever that thing is, whatever that movement is. And once again, it goes back to that being attainable. Because if it's something you enjoy and something you actually like, then you're more likely to do it.
Right. And I think that's like like when you add something to your checklist and you check it off. I mean, I will add like my morning workout to my checklist just so I can check it off,
Mm-hmm.
right?
Mm-hmm.
Even if I'm like here doing work, like I get something done that wasn't on my checklist, I write it down on my table. I've got this like dry erase table. Put it down just so I can check it off. Because like, I mean, obviously, like it's I'm like I feel better when I'm like, did I get much done today? Because I still have so much to do. But it's like, oh wait, I did. That was my check. That check is like do 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 do. Like, yeah.
Yeah.
Um, even if I only got 2 things and I want to get 10 things done, right? So I made an unattainable goal to get 10 things done. And I showed myself grace that I got 2 checks. So they weren't checks that I really even had on that other list, but and I got it done.
Yeah.
Okay, but versus and.
Yeah.
We'll have an episode on it.
Yeah. Yeah. We will. And that's the checklist can be for the movement, right? Like your app is a really great example of that. So you can go in and say, like, I want to do 2 exercises from just this app, right? And so that it's just something that I know is going to be good for me. It's building my strength. It's not just that's what I really appreciate about your app. It's not about let me build all of my show muscles for everybody to see. It's like, how do I actually like build my core and like build things so I do not hurt anymore? So that to-do list, bringing in the movement can like 2 different exercises from just as app. And like that can be 30 seconds, right? 30 seconds worth. And you do it however many times you want to do it. And so it's use that to-do list, right? If that's your thing, if it's not, that's fine. Don't need to do it. But you can use that. And that's an easy way to incorporate small movement, right? To really get you started throughout the day. And it's something you can do at home, right? Which is, I think, very helpful.
Yeah. And it might come down to like if you're maybe like a visual learner versus an auditory learner. So, because I'm super visual, that I think writing it down and checking it off like helps me. But if you're auditory, it might be what like you kind of tell somebody about it or, have that like way of like owning your win. Even if it feels so small, like owning it is like a big part of like realizing that I can do this. I can actually put movement into my day and I can get it done. And it doesn't matter that I didn't walk a mile. Like I walked 3 houses down and 3 houses back. Every patient that comes in my door, they know the first thing that they're going to want to do is like give me the report on like what has happened since the last time I saw you. And it's so awesome to see this transformation that happens over time. Because in the beginning, we're just putting out fires, right? Fire, 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 fire. Then as we're kind of progressing into that, getting closer to discharge of like, okay, so now for cardio, what works for you? And they're like, oh, I'll try this. And they come in, they're like, I didn't do it once. Not, you can be mad at me. I'm like, I'm not mad at you. What did we learn from that? That I'm not good enough. I'm like, no, wrong answer. So, what do we learn about you don't like this kind of cardio. You avoided it the whole time. Oh, okay. What's another choice? Does this count? I'm like, yeah, let's try that instead. And then all of a sudden it's like, oh wait, it wasn't that I wasn't good enough. I actually like I don't like walking. I don't like going for walks for exercise. I need my heart rate to be higher. I get too bored. Like I just start thinking about like I don't get into the zone. Like when I run, I get into the zone. When I walk, even when I was pregnant, I was like, oh gosh, I can't. These walks are like murder. Now I know what my patients say when they're like, don't make me do that. I'm like, okay, don't do that. So it's like everybody really is different. I need it to be a little bit more. I think it just comes down to heart rate. I think it's like I just need that bigger push, and that's just me. That's also I'm more that anxious side. Like I get that energy buildup and I like to release it. So I think I need that higher heart rate exercise to do that. It's just is my tendency. And so it's cool kind of watching this like transformation because nobody's ever walked them through it and to help guide them on like, I'm okay. Like I'm enough. And like when I walked 3 houses down and 3 houses back and I did it confidently and I wasn't worried about what my neighbors were thinking because we practiced it here in the clinic to ensure that you can do it safely. It's like this like big puff almost happens of like, I feel more confident. Like, I know. Isn't that cool? And for me, that's kind of the transformation I start to see of like that, like I have to test and retest. I have to try it and then see if it worked. And then I have to try something else and then see if it works. And the challenge is always if it didn't work, it's failures are how we grow. Like if we're not failing, we're not growing. So, and is it a failure or is it just a learning opportunity? So for me, I try as best I can to reframe that as a learning opportunity. And that's where we can actually start to see like, what is this individualized plan going to look like for me? Because that's really what it is, right? It's got to be individualized.
Absolutely. And the self-esteem boost, when you think about just from the mental health perspective, even if I walked 3 houses down today and then the next day I was able to do 6 and then I made it around the block. It's that self-esteem boost when we're just like, I feel so good about myself because I was able to do this thing that I could not previously do.
Right.
And that's the self-esteem and movement, of course, can go like hand in hand a lot.
Yeah. And I think gyms are so overwhelming for people to go to. It is like, I have so many patients that are like, please don't make me go to a gym. I'm like, I'm not going to make you do anything. One, I can't, you have free will. But like, it doesn't need to be overwhelming. One, right? So there's all sorts of different types of gyms. Like, you don't just have to walk into a Planet Fitness and like start sitting on machines. Like, you can go to classes. You can go to smaller, more niche gyms. You can, watch exercise videos at home on YouTube. Like, there's all different ways to do the strengthening based aspect of exercise that doesn't involve like feeling like you're learning in front of an audience, which I think is kind of what it can feel like in a gym. Do you have like recommendations that you typically like give people for like just how to get a little bit stronger?
I tell people try apps, right? Like if you're comfortable, because a lot of people, once again, it's really intimidating. It's intimidating going to a new gym. It's even if you've gone to the Y for 30 years, but it's a new class, that can be intimidating. It's really empowering. So I do challenge people, do it, right? Step out of your comfort zone. If there's something that feels like it would be helpful for you or enjoyable for you, try it. Try a new class. So I would either say at home, find a good app, right, that you can do from the comfort of your own home to start strengthening. If that is not your thing, if you just cannot kind of have that free will, right? Like I cannot make myself that discipline to do something at home, then try a class. I think classes are really helpful. Find a gym, ask around for something that is open, kind of accepting, that's going to meet you where you are. And a lot of gyms are like that, right? The smaller ones that offer like classes. And so various yoga studios, bar studios, like Pilates, right? They have all different sizes. They have beginner classes, they have intermediate, they have advanced. and you can always modify. So whatever you find that you think, I really like body pump at the Y. I think that's something that I could do. Great. And radically accept that you're probably only going to be able to do 25% of the class in the first time, but you did it. You went. So really challenging yourself to get out of your comfort zone, but find something that seems enjoyable, seems like it might be a good fit for you. If you've never weightlifted in your life, maybe don't just run to CrossFit for the first time, right? Maybe try something else first. So just meet yourself where you are, challenge yourself to get out of your comfort zone a little bit more, and then radically accept that just showing up is a huge first step.
And going to the back of the class. That's what I would do.
Absolutely.
Shoot.
Absolutely.
I'm like, And then you know what they do? Like everybody will turn around. I'm like, no, no, no. Don't look at me. I don't know what I'm doing. Like, just if you're following my lead, that is wrong for you.
Mm-hmm.
I just like to voice it. Like, I've never been here before. Like, I thought I was standing in the back. So if that happens, just say, hey, listen, everybody, I'm going to be really honest with you. Like, I'm putting myself out there. I'm a little scared.
Lean into it. Lean into it.
Yeah,
right? That embarrassment,
be okay with the
that
discomfort.
shyness. It's
and then
great.
people typically be like, oh, girl, it's okay. Here, I'll switch places with you. You can follow me. And I think the more that we're just like honest with the people around us too, of like, I'm scared out of my mind that I'm going to look like an idiot in here. It's like, rarely are we going to find somebody in a class that's going to be like, no, sucks for you, right? Like, typically they're going to be like, I got you, right? Like, I was there when I was first starting. Like, I will help you through this. And then you start meeting people, and then that socialization kicks in, and more dopamine gets released, and you're like, wow, I feel so much better. So, and then you can like tell all your friends, like, you've got to come to this gym. It was great. They were so nice. And then that's like, it's just the power of movement is like so huge. Like it helps you in so many ways, not just physically with organs and brain and lungs and muscles and tendons and bones, which is what we talked about last week, but from the mental health side, it is powerful stuff. Oftentimes my patients that are in chronic pain, I co-treat with mental health counseling because this is a huge part of breaking the pain cycle, and adding movement is a big part of it. In addition to all of, processing and all of the other things that I don't do that Dorie does do. So I just wanted to make sure that we really highlight in this month of movement everything that we can that ties into how it does benefit us, and just in a conversation that is like as accepting and approachable as possible. So if you found this episode to be helpful, please share it with somebody that might find it to be helpful, and make sure to stay tuned next week because we have more really interesting subjects coming up, and it's all about longevity and like what are the easy, simple things that we can do to lead a longer, healthier lifestyle and just have quality to our years.